All right, good morning, everyone. My name is Derek Hoy, and I'm the Veterans Health Officer at the New York State Health Foundation. I know these last several weeks have been incredibly trying for so many folks, so we really appreciate your attendance this morning. Today will be the first webinar of many in NYS Health's Practically Speaking series of online events, where our goal will be to share concrete ideas for adapting to better serve New Yorkers during the COVID-19 pandemic. The first session will focus on New York's veteran community in particular, so we couldn't think of anyone better to have kick things off than retired Army Colonel and Director of New York State's Division of Veteran Services, Jim McDonough. Colonel, thanks so much for joining us here today.
Thanks, Derek. Glad to be with everyone, and thanks for hosting this today.
Truly our pleasure. I want to dive right in since time is precious, maybe even more so during the pandemic. But before we kick things off, a few housekeeping notes. This webinar will be recorded live, and a recap with the link to the recording will be circulated afterwards. So keep an eye out for that and be sure to share with whomever might be interested. Also, video and audio will be disabled for attendees, but please be sure to type any questions or comments you may have into the chat box throughout the event. And I'll be sure to save the last 10 minutes or so for our guests to address any questions that you all may have. So without further ado, let's dive right in and start with a little context. As of this morning, the Department of Veterans Affairs reports that they have currently 1,280 active cases of COVID amongst veterans and has treated over 9,000. Also this morning, however, Leo Shane over at the Military Times reported that there was a big jump in coronavirus deaths overnight at VA, an increase of about 50 since 5 p.m. yesterday, making the total deaths 1,191, and that's reflecting a 10% increase from last week. We do know, though, that reporting isn't great. On top of that, this is just from VA. So only about half of veterans are even eligible for VA healthcare, and only about 1 in 3 will actually step foot in a Veterans Health Administration facility on any given year. So my first question, Colonel, is what has the impact of COVID-19 been on New York State's veteran population, and where are we currently?
Yeah, thanks. I'll use a simple word right at the top, I think, to describe the effect on our veteran families. It's been tragic. I mean, when you look at this in the sphere of what's going on in our state in particular, I've been tracking the same numbers, and 20% of all those who have died due to COVID-19 complications within the veteran community are in fact from right here in New York State, when you look at the overall impact. So it's been widespread. You know, you could look at this through the lens of, you know, veteran unemployment. You could look at it through the lens of elder care in nursing home facilities or state veterans homes. You could look at it through the lens of what I've looked at it through hard, the benefits delivery system and the disruption that's occurred within that, really wiping out traditional modalities to a certain extent on how veterans access their earned benefits. And so it's been dramatic, to put it mildly. Then you couple with it, you know, the increasing social isolation that we've always feared within our community because of who we are. So you find a lot of complicating factors right now, Derek, in the lives of our military connected families.
Yeah, absolutely. You touched on so much because I think that's the reality of it. So much is happening. It's not just a health epidemic, it's a financial epidemic at the same time. And we're seeing that certainly unfold. And it's really wild to kind of look back on things 2 months ago, let alone 8 months ago, when you and I were sitting down for our in-person regular conversation with events at the foundation. And looking back on that, you know, we were discussing you kind of taking over the helm again and, you know, what your plan was. We had just released a report that we partnered with Syracuse University's Institute for Veterans and Military Families that was a survey of all states, all 50 states DVSs to see how we could strengthen our own. And I can't help but to think about the Mike Tyson quote where he says, everyone has a plan until they get punched in the face. In the military, we say no plan survives enemy contact. And I think that's certainly true of this case. So my second question, since we are focusing on adaptability, would be specifically, how has DVS in particular been adapting? And kind of what has your plan looked like, if at all, to respond to COVID-19?
Yeah, so I think everyone knows, you know, we operate a statewide benefits delivery network of accredited benefits advisors. And when I first got back to public service, you know, the idea was that, and I don't want to say no one saw this coming, but as we look to the future of benefits delivery, we certainly wanted to take on more of a mobile approach. The idea being that if 70% of our population that we serve is age 55 and above, you were going to have to do things differently to get in front of them with benefits. Things like home visitations, going into prisons, going into nursing homes. You know, these are places where one's immobility shuts you out of the benefits delivery system. So when I first got back, we really did embrace this idea is we've got to go to our customers. So we became more mobile. And we established, even before this occurred, there's a bit of irony here, all our field supervisors and our training team, we put in a teleworking capacity. This was before COVID-19. Very innovatively developed a work from home model for those who supervise individuals in the field. We made them more mobile. You know, we were purchasing laptops, mobile printers and scanners. We were already in the thick of doing that. And then this hit, you know, about March 20th or 24th, I think, the VA regional offices across the United States just closed their doors. And traditionally, we have walked into those facilities to access earned benefits. And many of our traditional veteran service organizations were co-located in those facilities. So all of a sudden, the traditional pathways into benefits delivery, they were closed. So the idea in the middle of this is, you know, okay, how do we accelerate mobility? How do we accelerate teleworking? How do we accelerate work from home? In the middle of this pandemic, we purchased iPhones for all our accredited benefits advisors. We actually invested in a bit of technology that allows the division, one of only a few in the United States, to digitally upload claims packages for VA benefits. We did that in the middle of this pandemic, about 4 weeks in, working with our third-party vendor, our case management system. We developed the coding for an API that allows us to take a fully developed claim, which we were doing in cloud fashion previously. We were always doing our work digitally, but we were having to print it and introduce it to the VA old school way. Well, that shut. So we developed the interface that allowed our system to talk to the VA system digitally. And now we're transferring fully developed claim packages with the VA at rapid rate, trying to mitigate the disruption that's occurred in benefits delivery. So we've had to adapt. And right now, as we face reopening, we've had to kind of combine what you see the rest of the world doing with social distancing and all the CDC guidelines and Department of Health and kind of bake that into our model. But we are not going to remain static. For those who we need to remain an office that gets visited, you take the necessary precautions to include digital thermometers and the things that you're seeing in the news. You're affording that to clients, and we will remain open that way. But we will also be highly mobile, going and developing claims through virtual veterans benefits advising sessions, you know, like we're doing today. There's no reason that I can't sit across from you on a screen and complete your benefits delivery without even seeing you. Wet signatures, digital signatures. These are all the things that we actually have stayed open and remained open by adopting our business model. And I will say this too, Derek, we're doing it for our partners, county veteran service agencies, the traditional VSOs that we can work with and want to work with. We're trying to unify the approach along these mixed modality delivery systems that we now have to have. So.
I definitely hear that. It makes complete sense. Really looking at the way things were trending regardless, and then certainly looking how we're adapting now. I really appreciate you sharing that with me. And, you know, the goal was kind of to have like a top-down view, to have a more broad stroke look at, but you mentioned so many of these things are incredibly important. And just again, let folks know, please throw some questions or comments into the chat box. We actually just got a really good one now. I'd like to just kind of jump to it really quickly. But, you know, there was a JAMA article that said that, you know, basically this is the perfect storm to exacerbate the likelihood of suicide moving forward. Like you mentioned, social isolation, decreased connectivity with a lot of our support systems. So what should we do to identify vets at risk and intervene early to prevent, you know, what is also a larger pandemic, which is suicide across the nation?
Yeah, so a couple of thoughts looking at this through the lens of the last, 75 plus days. One, the idea of buddy checks, this is kind of simple, but and old school, but the idea that we learned from military service, to our left and our right exists someone we care for deeply. To what extent are we all going through that effort to connect with people during these really deep periods of extreme isolation? It takes all of us to kind of reach out in that old-fashioned way. I remember when this first started, we went through our case management platform and we mined 32,000 unique emails. And we placed them in the hands of our benefits advisors, and we encouraged them to use an email to reach out to someone that was a previous client or a current client just to check. And I think if you look at that through the lens of like what all of us are capable of doing in our own networks, in our professional networks, in our personal networks, I don't know about you, Derek, but I've certainly had people check on me and I've checked on people. It's one of those things that, hey, how are you doing? And these are guys we served with and young ladies we served with, that we take it upon ourselves to accept the responsibility to look out for others. That's always been us. So I think that's one piece of it, right? And you'd like to see that sustained. You'd like to see this culture of caring kind of come back more into the forefront of our society. I certainly am that. But I'll tell you, the other thing is like we need better tools to screen. I'm a big fan of the Columbia Protocol. I believe things like that should be in the hands of everyone and not just clinicians. We all need to be dialed in to what risk looks like in conversation, in appearance, in relationships. And certainly I think we see it in our day-to-day lives, the stressors that are impacting people's lives. So I think we need a full court press into the whole identification piece of this. And then what do you do if you find it? Does everybody have an answer if you find it? And so we've got to develop these plays that begin with individuals, that begin with connecting to people, but begin with better tools that go into screening, and then better responses that are, the right sensitive approach to someone presenting problems in themselves. I've seen it personally. I've been on a call with the undersecretary for the Veterans Benefits Administration when we did the New York State Teletown Hall. I got messaged in the background from him personally that someone had reached out to him in a chat box, with problems, and we jumped on it immediately. I just think that this opportunity before us allows us to revisit some of the things that have been tried and not necessarily been successful, but to take bolder steps into this connective responsibility that we all bear to look out for our fellow mankind. And it means we need to do a better job of looking for this. And it takes tools and it takes people who are willing to stretch themselves and ask difficult questions and then do something about it.
Absolutely. Just really couldn't agree more there. I think it's interesting to look back on kind of like the basics, if you will, just calling someone, checking in. Something incredibly meaningful happened to me just a few days ago. A friend of mine reached out and said, hey, I feel like you're probably the last one that would need help. You're connected in the community, you have people around, which is why I wanted to reach out, because it's usually the folks that you don't know, they're not showing signs, they're too busy covering down. And fortunately, I've been in a good place, but it really meant a lot to have someone reach out to me. And I'm sure that must be the case, multiplied 1,000-fold when all these other folks are calling and asking. So that's really great to hear that. And I like your idea of a full court press, because there is no panacea. I think we are going to have to really, rely on evidence-based modalities, and also, be a little entrepreneurial at this point, because it is going to take a lot of effort to keep things moving in a positive trend.
One point, Derek, if I could add just one final point to this. The point of entry for me over the last 2 months with a lot of people has been unemployment insurance. I get emails and calls from people that I've worked with throughout the years, like, hey, can you help this guy? And because I work in government, and I have relationships with the Department of Labor and some of the folks I've made, really deep friendships with, I'm able to kind of just say, look, anybody call me, email me, text me, whatever you need. I did a Zoom meeting with IAVA and the New York City Veterans Alliance and gave out my cell phone number. And a lot of that was oriented on just help with unemployment compensation. So it's been interesting because the word co-occurrence, this stuff is so overlapping the level of needs right now. These are not singular needs. These are complex issues that have been made worse because we're not connected to one another.
Certainly, absolutely. Thinking of like the Dwyer Project and other folks that are doing, meeting veterans where they are, DVS on the city level with Buddy Check, the mission continues. A lot of folks doing some really great stuff. I'm going to send one more question your way, and then we have a ton of really great questions from the audience, so I'd love to turn it over to those. Um, so basically, in the funding space, we've been talking to other funders. What are you hearing? How can we help? We've really been trying to talk to folks that are doing the work and see where we can be useful. And one thing is that it's a really frightening thing to hear, but the term extinction level event has come up for nonprofits. And, as we know, this is certainly a health pandemic, but also it's a financial crisis at the same time. So we know that a lot of folks aren't able to help support VSOs and a lot of the other traditional nonprofits. So my question to you is, what have you been hearing from other VSOs in particular? What advice do you have for them to get through this and make it through the other side? And lastly, certainly thinking about, since we do have an opportunity to change things, what would you like to see change moving forward?
Yeah, so I certainly think in every problem set there's opportunity. I'm the eternal optimist here, but I was talking to a group last night about this very dynamic that, a philanthropic shift towards, public health and response to COVID-19 certainly is in front of us, right? It just is. And I've got a meeting later on today about this very issue. For me, COVID-19, it's not outside the veteran community, right? There are points of leverage here. As if I were approaching this from someone needing to raise money and get in front of those who are, interested in supporting human needs, I certainly would make the case that, this population, our population, and really digging into the whole social isolation pieces, why are some of these really good services in a community setting necessary beyond what this is? And I've talked about this several times. It does take a pattern of care, service, and resources to do this work best. I mean, we'd like to think the government can solve the problems in its exclusivity. It's just not true. Mm-hmm. You pointed out at the top of the webinar, like only half of our population is availing themselves of VA healthcare. So what about the other half? So the argument is there that, but you need to be smart. If I were talking to people who have to raise money in the nonprofit setting, is that you begin the conversation with the impact that COVID-19 has had on your population. You start there because it creates some shared understanding that these are not problems unique to the out of veteran community. It affects all of our communities. So I'm going to go through life making the point that this has had a dramatic impact on our organization. And we are connected to public health. Look at suicide prevention. You and I are part of the Governor's Challenge series to prevent suicide amongst service members, veterans, and their families. We were talking as leaders the other day. We're going to jump into that pool in a public health way, using COVID-19 as the basis of a conversation, because it has created further isolation. It has created greater risk. And that's why these services are still needed. Despite the fact that funding may be shifting, the argument to be made is we still are here. Nothing changed. I looked at Memorial Day through this lens, where there are attempts to kind of, really, really deeply connect with, our population on Memorial Day, and all around us, there's tragedy and death and suffering of everyone adjacent to us and within our community. We are one in the same. And so you're going to have to be very discerning. You're going to have to make the argument that COVID-19 has had an impact. And you're going to have to go through this period of life where you're going to have to work harder to attract the funding that is necessary to fuel very good nonprofits. But it can be done. And so I look at it through that lens. And we've already thought our way through this problem set, Derek, that we have to be relevant. We can't exist outside the orbit of what the nation is concerned with. We have to be part of that argument. We are part of the COVID-19 public health pandemic. We need to begin the conversation there, but continue to kind of drive home the point that services and care and resources for the nation's military connected families remains vitally important and still within the giving profile of many people. Mm-hmm. But it's a little bit sidetracked right now, but we got to bring it back. And so I'm going to work hard to be relevant to the times and stretch the conversation in such a way that we are still here. So that's my simple advice. It's going to take extra effort. There will be a contraction, I think, as we all expect within the nonprofit community. It's tough to survive these very difficult times. The best leaders will emerge, make strong arguments, and develop the funding patterns. But I know it's going to be hard for a lot of people. We wrote about it in a recent paper around veteran service organizations. I mean, they were stretched to begin with.
Absolutely.
And so now you're competing with a lot of very good interests, but how do you do it? And I think it's going to take strong leadership, outcome data, evidence-based practice. That's the stuff that's always going to prevail.
Mm-hmm.
So.
Absolutely. And you touched on, again, so many great things there. And I'd love to pick your brain further, but we have some really great questions from our attendees here. So one thing that it seems to have come up a few times, and I appreciate everyone asking this, you mentioned kind of co-occurrence and not being, that space not being exclusive. And one thing that's really interesting, a few people have mentioned this, is there any special or particular resource available? Let's just say that there is a frontline healthcare worker and she is, taking care of everything, but she is also, had served in combat or served in Afghanistan or maybe experienced trauma before this. Are there any resources for veterans that are also frontline healthcare workers currently that might be, their symptoms might be exacerbated by current trauma?
Yeah, I think you're starting to see those things pop up. So I think in response to this, you're just starting to see special care being taken to those who kind of co-present. I mean, you talk about an individual who served their country. It might be an EMT, might be a nurse, might be a physician's assistant, or might be in the funeral business. My own family growing up in that. You just look at the level of impact this has had around individual lives that now have overlapping things. And so I'm starting to see this sense that, wow, we really need to do something for these people who may have experienced tragedy before, jumped into this deep end of the pool to serve their fellow human beings, and their problems might be really, really complex. So I think you're going to see, mental health and mental health treatment kind of diverge a little bit to look at populations who serve their country, but now might be serving in a different way, and stretch themselves to offer themselves to beyond what they might have traditionally been doing if they have the resources to do it. And so I think you're going to see this double perspective emerge where you might have been a veteran and you're now a funeral director, or you're now a nurse. I have a niece who's a nurse who grew up in a military household, and she certainly asked me this question. So I think it's yet to come, but I think we're going to be dealing with very good organizations that are going to stretch themselves out of the necessity to kind of peel back the layers of complexity that might be associated with the mental health needs of an overlapping population. So certainly those who are first responders draw upon those who served. It is largely a population of many of the same. And so the issues, and I was talking to an organization about this very point. Do you stretch yourself to kind of go in that direction, recognizing that the majority of people who are first responders may in fact have served their country? And the short answer many of them are wrestling with is, I'd like to. We need to develop the resources to do it. So it's a little bit of early evolution. And I think the smarter organizations are trying to develop the resources to be capable of doing that. And then you'll see them stretch.
Thank you so much for that. And you'd kind of touched on this a little bit previously, but when we're looking at outreach, of course, for all the reasons you mentioned, incredibly important. But I think there's also the culturally competent outreach that's important. And I think that is in relation to who's doing the outreach and who's conducting the outreach and who's being connected with resources. So are there any specific approaches, perhaps, let's just say like tribal areas of New York for women, LGBTQ folks? Are we looking at this kind of as all New Yorkers, or are we able to kind of sparse out certain populations, do specific outreach?
I think it's a question of both, right? There's what you do for everyone, and then it's what you do specifically to get your message and your means in front of certain subsets of our population. I'll do an event with, Ashton at Sage Vets around Restoration of Honor Act that we're in the middle of rolling out, right in the middle of this, a new way of approaching benefits delivery for those who have been discharged uncharacteristically. So we have to do both. And this is, I think this is important to understand. People might want to rush to digital as being the only means, right? We know we're going to have to become largely virtual and largely digital, but you're still going to have to really mix it up and match your means and your message with the population you're trying to reach. I mean, we're still going to have to go in nursing homes. we are still going to have to go in prisons. I mean, you can't give up on doing all of it. And one cannot come at the expense of others, I would say too, Derek, is you really do have to really mix your toolkit at this point. We will certainly rely upon heavy digital and heavy social media to get a message out there, but we're going to have to really tailor it to what the recipients are in the middle of. Are they incarcerated? Are they infirmed? Do they not, in fact, associate with traditional veteran service organizations because they may be, deeply rooted in the LGBTQ community? So you got to stretch. You got to really stretch yourself. And again, it comes with finite resources. So you can't do all things to all people all the time, but you've got to really bob and weave in the middle of all this and make yourself relevant to all of it.
Absolutely, definitely. So we have just about 2 minutes left, and I want to give you just about a minute or so. Just if you want to kind of let us know, any updates, resources, anything that you feel vets or VSOs or those in the vet community can take away from this webinar before we wrap things up. Yeah.
Hey, just because it's tough, do not think that it's not time to reach out to those who are here to help you. And help can come from this unemployment insurance issue affecting 40 million Americans. This is the point of entry for a lot of people. The economic hardships that many of our veteran families are confronted with right now, this is the perfect time to establish your benefits and to reestablish healthcare or establish it. If you haven't dipped your toe in the water of VA benefits, state veterans benefits, or VA healthcare or care in the community, this is the time to do so. This is exactly the time when you need to be brave enough and confront the behemoth system that it is. Here's how you do it. You reach out to the people that I have the honor of working alongside, these community-based organizations, and you make yourself known and your needs known. This really tough period, this is exactly the time I want you to emerge from your basement, from your living room, from behind the camera, and present yourself to people like us and the people that I work with. So that's number one. Let us help you. Don't let your pride get in the way. Do not let this period hold you back from what you earned and what you need to do to get on with your life. So that's the most important thing I think I can say, Derek.
Oh, and that's incredibly important. Colonel, thanks again. And really appreciate your leadership during this time, all the work that you and DVS has done, certainly throughout the state. It's greatly appreciated. And of course, everyone, thank you all for joining us today. Had a ton of great folks chime in, so we really appreciate that. Thank you for all your questions and of course your attendance. Our next webinar in the series will be on June 8th. So please, join us for that, where we'll be learning about community-based health screening tool for tracking COVID-19 in Rochester. So be sure to sign up for our e-newsletter and follow us on Twitter to keep up to date on the latest at NYS Health. And we'll be sure to send a recap out with this recording and also send any questions you all may have our way. We'd love to hear from you. And thanks again, everyone, for joining. Colonel, it's been a pleasure and look forward to doing this again with you all soon.
Good seeing you, Derek, and thanks to everyone, and stay safe.